And we got some really positive feedback around that. We liked the webinar as well ourselves, but more importantly, also the audience told us that it was useful. And actually, we asked a couple of questions. For example, if people would see themselves using the tools, some of the tools that were presented. And feedback that we got back was mostly yes, people could see themselves using this in the future, either with a potential use case that could come up, but also some people really had a very specific idea in mind already. So I think at least for me, the feedback was the ideas that were presented could really be put in action by the people that attended the webinar. So we were very happy to receive that feedback. We also asked the question if people wanted to see a similar webinar in the future. And also there, the feedback was overwhelmingly, yes, that would make sense. Maybe some changes to the formats. We've tried to take some of that into account, but mostly an overwhelming positive feedback that people would be interested in doing another webinar. And so here we are. Of course, at SURF, we aim to please, and we also really enjoyed doing the webinar. So we were very happy to organize a second webinar, and that is where we stand today. And once again, thank you all very much for joining. We're excited to have you there. More than 100 participants already at the moment, and the number is still climbing. So that's great. I really think that shows the interest in the topic. Before I continue, a couple of practical matters that we need to share with you. First of all, the webinar will be recorded. Slides and the recording will be made available afterwards, so you can also listen back in your own time. The link is there. We will also include it on the website, of course. Only presenters and the organizers have video and audio. So if you have a question, please put that in the chat window, and then make sure that you chat to everyone and not to all attendees, because if you select everyone, also the panelists will see it. At the very end of the webinar, at about 3:30, we have a final question inviting you to leave your contact details, your email address, if you would wish to be contacted about a specific presentation, a specific technology that you have heard about, and then we can follow up with you about that in particular. So moving on, for those of you who were present at the earlier webinar back in June, you may remember that we are not only all about aiming to please at SURF, but we're also curious. And in particular, we also like to know a little bit about you as the audience, to have a bit of a feeling who we have in the room. So I would like to invite you to open up Mentimeter and go to www.menti.com, and then use the code that you see at the top of the slide. And we'd like to hear, just to get a little bit of a sense of who we have in the room, if you would mostly see yourself as a user of privacy sensitive data, somebody who is mostly interested in using data, or if you see yourself as mostly a provider or representing an organization that could provide privacy sensitive data, or perhaps both, or perhaps neither. And we see the results coming up on screen. So I'll be silent for a little bit and see what comes in. Thanks a lot. So a lot of people who see themselves wearing two hats, if you like. They both speak from the perspective of a user as well as a provider of privacy sensitive data. Also quite a number of participants who are neither. So I think they're mostly interested in the topic, but not really themselves in the position of using or providing such data. Interesting observation is there's a limited number of people who only see themselves as a provider, but not also a user. So that's an interesting observation straight away. All right, thank you very much. We have one more question. Let's move to the next slide on the Mentimeter before we get started with the presentation. So while we were preparing this and we were discussing the webinar ahead of time, we were talking, of course, about the topics and the presentations and the content of them. And at least to me, what sort of stuck is, I guess, one of the themes of the presentations today is sort of contrasting, comparing different approaches to handling sensitive data and the sharing of sensitive data. On the one hand, we'll have some presentations that I think are mostly about control, having access control and making sure that only the right people can access the data, and perhaps controlling what it is that they can do. So really exercising control on people being able to do research with the data. And then another line of approach, another direction of solutions, if you like, is to modify the data. So you take a different approach, not so much trying to control and having additional measures about who can access it, but rather changing the data, making modifications, for example, anonymizing the data, pseudonymizing the data, or creating synthetic data that is similar to the actual data, but then does not have those privacy concerns, and making that modified data openly available. So to my mind, those are really two different types of directions you can take. Either you maintain the same sensitive data, but you add control and measures that speak to control, or you go the other route and you say, well, let's modify the data and make a modified version of it that is can be shared in a more open sense without such control. So we will hear more presentations about, yes, specific technologies, specific solutions along those two directions. But at least for me, that was one of the themes that I think is interesting to compare and contrast a little bit, also maybe at the end in the panel discussion. What I wanted to ask you now, just, and I realize this is still high level, right? But just on that notion of going the route of controlling your data versus opening up a modified version of the data, I would be really curious to hear back from you what you would expect makes the most sense for you and what would best meet your needs. Interesting. It's about a 50-50 split. Modify is taking a small advance here. Almost 50-50 with a little bit of additional votes going to modify. So modify slightly in the lead. Last opportunity to cast your votes. All right, and then, well, the winner, between quotes, of course, in this case is modify, but with an ever so slight margin. We have the same question at the end of the presentation, so we're really curious to hear if after, hearing these presentations and hearing about some of the specific technologies that you will be presented today, if perhaps that view has changed, and perhaps, the people would see more benefit for control, or maybe even more for the approach to modify your data before sharing it. But thanks a lot for that. This is a nice, just to get the temperature in the room for before we do the presentations, and then we'll do the same at the end. Moving on to the presentations. Could you go to the next slide, Freek? Thank you very much. So we have a couple of really nice speakers. We're very happy to have them from a variety of backgrounds, some more in academic settings, also some more industrial settings. They will speak about that in more detail, and of course I will introduce them. But I really think it's a nice range of different approaches, but also different contexts in which they operate. So what we will do, similar to the first webinar that we ran, we will first have these 5 presentations. We do them as lightning talks, 10 minutes each. If you have questions, please put them in the chat window and make sure that you send the chats to everyone. So we will collect them, and then after the 5 presentations, we'll go back to the questions, and then we have a bit of Q&A and also time for more broader discussion. So with that, I wanted to invite Hayo and Joep from Dexes to kick off with the first presentation. Let me give just a brief introduction. So Hayo Schreijer is the co-founder and product manager of Dexes. Dexes won a competition by the Amsterdam Data Exchange. You might have heard about them in that context, creating a data exchange platform that makes data findable and shareable while respecting data sovereignty and privacy. And he will be joined today by Joep Meindertsma, who is the Chief Technology Officer at Dexes. And previously, Joep built an e-democracy platform involving people in decision-making, also a super interesting topic. Joep, I understand you will kick it off. So, sorry, Hayo, you will kick it off. So the floor is yours.
Thank you. Let's see, share. Can you see the presentation?
Yes, go ahead.
Perfect. Well, thanks for joining us. We're Dexes. I think Hylke introduced both me and Joep already. We have 10 minutes, so we're going to do a short introduction actually to what it is to make an open, fair, and trustworthy data space to share data. And it's actually really an introduction to decentralized data exchange. So I think the speakers who will follow will go more into depth what it means to share sensitive data. We're going to just tell you what we're doing and what we're organizing. Just what we're doing today, just give you a quick view of what we're doing for Amsterdam and the Amsterdam metropole area. What is it, decentralized data exchange, and what do we do exactly for what use case? To start with, well, Hylke already told us we were actually the winner of a contest that was written out by Amsterdam, the municipality of Amsterdam, and actually the metropole of Amsterdam called the MRA, which said build a data exchange service which is open, fair, and trustworthy, and tell us how you're going to do it. We provide some money, but make sure that you build an independent, neutral company that will run this service. So we as a public partner and as a private partner can use this service without being involved in it. So that's what we proposed, and that's how we won the prize. We started in March, and we have a duration of 2 years to actually do what we need to do. Who are we? We are 3 companies. Textinfo is the first company, actually development company. They're building data override, one of the main national data portals, for example. Second company, Argue, which Joep is from. I think Hylke already told what Argue is doing, working a lot in the public domain. And I'm from Coerensa, project management and product management company. And I, for example, did work on overheid.nl, and we're building the national legislation database, wetten.nl. And we work a lot for the public domain, police, the national police, and everything connected to it. We cooperate a lot, and maybe it's good to mention 2 corporations we have. Maartje Blijlevens, who helps us a lot to set up communities around the data space, and Madaster in the left corner, who is one of our use case partners. I will come back to this in a moment. Then for you, he's going to tell you what's the problem really that we're solving. What's wrong with the web? What's happening? And Joep, is your microphone open?
Yes. Yeah.
All right.
Hayo.
I'll do the clicking.
Thanks for sure for having us. So if we go to the next slide, we'll see a picture of the very first web page presented by Tim Berners-Lee, the inventor of the World Wide Web. And when he basically envisioned a World Wide Web, he thought of it as a really decentralized network of connected servers, which all had their own web pages. Can I have the next slide? Which looks kind of like this. And this is how the early web looked like for the first 10 or 20 years. But now we're already 30 years down the line, and the web is starting to look way more like this. We have a small amount of really big nodes, which take up most of our data. And that is not a problem by itself, but it is when you look at how we interact with them. They start to become middlemen, which means that we are missing the direct links between individuals and organizations. These organizations in the middle actually provide us the APIs to access our data and to do the access control management. And these are all very different APIs which no longer really communicate to each other. And to demonstrate this, can I go 2 slides to the next? So every single color here represents like a different kind of API. For example, Facebook. If I want to look at someone's picture, I have to send a request through Facebook. Facebook decides what kind of interface I'm looking at, and they ultimately send me the picture. And this is not just a problem with social media or with like these big companies, but this is happening all around us. We're creating data silos, and these data silos are the direct result of having closed proprietary APIs. So when we thought about making a data marketplace, one of the very first ideas that came to mind was to take a similar approach, that we are the middleman. Basically, that we host the data as a data marketplace, people make transactions on that system, yada, yada. But this is not how we're going to work, because we want to use the decentralized internet. So how are we going to do this? Well, we have a direct link between people if people are actually in control of their own data. How do we do this? by providing them with their own servers. We call these servers pods, personal online data stores. And these pods are not just responsible for hosting the data, these are also responsible for providing access control. And they are also responsible for doing identity management. So instead of logging in with like a Facebook or Google account, you can log in with your own very personal server. And these servers, they also make sure that data deals are made. And a data deal is an agreement between a data owner and a data user, where it has been made very explicit and machine readable what is actually being agreed upon. Can you reshare the data? Can you edit the data? Is there privacy related stuff inside of it? So as Dexes, it is our role not to be a middleman, not to host the data, but only to facilitate this data deal making process. And how do we do this? In 3 ways. 1, by making sure that the data owner can be trusted. How do we do this? Well, we can provide things like reviews. And when you try to buy some piece of information and it's not there, you get a refund. And second, we make sure data is actually findable. So we're creating like a really big index where you can search data sets and find the right one for you. And third, we're working on standardization, because the only way a decentralized approach like this can work is through a really, really high degree of standardization. And in order to achieve this, we'll use Solid. And Solid is a new project created by the guy from the first slide, Tim Berners-Lee, who was pretty much disappointed with how his World Wide Web is currently turning out. It's way too centralized, and Solid aims to take down, aims to combat this current paradigm of monopolized APIs. And Solid is being developed by the MIT. It's being supported by the W3C. They also have their own startup called Inrupt, which Tim is the CDO of. And we're actually highly involved in making sure this all gets realized. So what is the product we're currently presenting? The main thing is the DexPod. This is this personal online data store, which does, next to storage, authentication, providing you who you are, making sure you can log in with this specific server, authorization, so you can control who gets access to your data. It can make data deals, and these are very explicit machine-readable agreements, which are actually cryptographically signed, so you can be really sure that 2 parties are agreeing on the same thing. And all of this is going to be open source and fully free to use. Thanks, and back to you, Hayo.
Thank you. Last, to conclude, what Joep is actually telling us, we're moving to a different way of sharing data. I won't explain this picture, but you see in the bottom what decentralized data exchange means. No man in the middle, no copies of data, a support network that supports nodes to share their data and not making copies of this data. The data stays in their Dex pods. What we're doing at Dexes, and that's the last minute we take to explain you what we're doing, we're actually building services to provide trust. So it's easy to give access to data without giving up your ownership of the data. How do we do this? We add a few services. A data catalog that shows what data there is, a service catalog that shows what kind of services you could use, and the next speakers will probably tell you about these services. And in the middle, the purple block, and make sure you have interaction, you have agreements like a data deal, and there is some governance in place. And you see the DexPod as one of the ways to share this data and make it available. What is important for this? What are our principles? We make sure that the conditions to share data and the offering you make as an owner of a data is really transparent. What are my conditions? Do I want you to sign an agreement, or do I want you to log into something? The second is mentioned by Joep. We close a data deal for every transaction that's made. It's clear, it's transparent what were the agreements we made as a user and as a data owner. There needs to be some dispute resolution when something goes wrong, when something is not according to plan, when someone is not keeping up with the agreements that are being held. And a real big thing for building trust is audits and logging. See what's happening when you use data. And what we see is that a lot of partners could use the service we offer. And probably the next speakers like Syntho will show you what kind of data services you could use to provide sensitive data to other users. Well, this is our closure. We have two use cases we're working on, one with Madaster and one on the Corona Crisis Data Exchange, both in the Amsterdam environment that we're working. And we have a lot of nice things to look out for. It will be a great year. At least we hope next year will be better than 2020 and see each other a bit more in a physical sense again. Thanks very much. This was Dexes.
Excellent. Thank you very much, Hayo and Joep. And we hope to welcome you back next year in a bright and sunny future and hear about your achievements.
Yeah, exactly.
So we're moving on. Notes to the audience. If you have questions at this point, please put them in the chat and then we'll pick them up afterwards for the Q&A. But now we'll just keep the momentum going with our next speaker. It is Guido van het Noordende, who founded Whitebox Systems after completing a PhD at the VU and a postdoc at the UVA. Whitebox Systems is a decentralized, privacy-friendly information exchange for healthcare, controlled by healthcare professionals and patients, based on push authentication. And I'm sure Guido will tell us much more about this. Just on the name of it, I have to say I can really relate to Whitebox Systems, finding myself in my home studio at the moment presenting this. Feels a bit like a Whitebox system, but I'm sure you have a different take on that. So, Guido, the floor is yours.
Thank you. Let me see. Share. Am I already sharing my talk? Sorry, I'm just not really sure. Yes, I'm sharing a PowerPoint.
Yeah. You are, but yeah, exactly.
Okay.
Yeah, we can see it fine, Guido. Please go ahead.
Thank you. Thanks for inviting me and giving me the time to present a bit about Whitebox Systems and the context. Of course, there's only 10 minutes, so I'll only gloss over the ideas. To start with, I'm indeed director and founder of Whitebox Systems. I will also found a Whitebox Foundation in the foreseeable future because we really need to separate the standardization efforts from the products that we produce with Whitebox Systems. Whitebox Systems is a startup from the UVA, and I currently also have a research position again at the UVA part-time to study authorization systems in specific contexts. And I will be, we'll get back on that in a few months. So, although I was presented and I'm mainly known with Whitebox Systems for managing data management for clinical use, which I will go into at the end of this talk, I think most of the people in the audience are involved with data management for research. So I would like to start with that context. And first of all, start with describing some of the problems with that. I see the way that currently research data is being managed. So even though sometimes the data is pseudonymized or anonymized, I see some pervasive problems in how data is managed when it comes to research purposes. One of the things is the weakness of consent. It's very easy to have an overly broad consent and sometimes even to share data without consent if it's anonymized or pseudonymized. And that remains a persistent problem because it basically allows parties to do copy again data and to basically consolidate data of multiple parties and recombine data, which was originally by, when it was shared, was considered to be shared only with one particular party, but often case data is shared much more widely than people are aware of. And there's also some incentives because basically there are a lot of big research, large research databases out there. And the people that have built those databases and collect data from different sources, particularly in healthcare, sort of presume some kind of ownership over that. And basically all that is intransparent, and also the incentives are intransparent. And that touches a bit on the last talk, actually. Another thing is that oftentimes anonymization or pseudonymization is considered to be a solution, but often case anonymized data is easily re-identifiable, so that's not really a solution. It's more of or of hack, basically, to get the system going. So more specifically, a problem that I see is that data sets with often anonymized data, but when it's microdata, so the original data sources are kept intact and basically as individual rows in a database, there's oftentimes downstream recombination of data sets. And that facilitates easily re-identification of the data set, because it's oftentimes, well, it's a sparse data set, so there's so many unique identifiers in there. And basically the data in the data set increases. And we all know how this works, because that's exactly how advertisements and marketing cookies and so on work. They basically combine data over multiple sources. A specific problem is really that all this makes it very hard to track your data. And this problem is increased when you think of really sensitive data that has to be tracked over time. And one particular use case that I'm involved with is for a personal locker project that's being managed in Leiden, and as part of my research position is involved with that. And that's about managing DNA data, and it's actually in the context of the personal health train that some people might know. And the problem there is that DNA data is actually not yours to share, so consent is basically a no-op, because you cannot really share DNA data with a consent that you give, simply because family members might share some part of the DNA and also have rights of ownerships of that. And really the only way around that is to make sure that you can track the data really well when it goes, over multiple parties and is being shared with multiple parties. And that idea and that problem should also be applied to research data. So we're trying to tackle that by going for a completely decentralized approach. And the goals are that by going decentralized, we can separate the responsibilities and concerns of the parties involved, because we can avoid that parties are both data owners and policy managers, which is often the case at this time when it concerns research data collections. The parties both have an incentive to maintain a very large database collecting a lot of data, and they're responsible for sharing it with researchers. So it's basically a double responsibility, and there's mixed incentives there. What can you do with a decentralized approach? You can control and track data at the source, and that means you can, if you do this well, keep track of where data goes over the life cycle, and I'll just show you how that works in a second. Another thing that comes with that, if you have control and you have tracking and tracing, it's easier to withdraw access than when data is, copied out of control or out of sight. It's important as a goal to be able to use up-to-date data, but also to withdraw or change data elements that basically are rights that you have coming from the European data protection legislation. And we really want to form networks around the patient, or the subject. So you really have minimal access. So you try to form the access and to make sure that only people are legitimately involved with research around you get access to the data, and not some third party in the middle. So the approach we have is to build decentralized networks where people can access data, but they only can access it from the source. And it's important then to have some kind of a system where you can easily extend or scale down the network around the patient or around the subject. So what is the classic view for sharing data and research? It essentially is copying data. The classical idea is that you copy data from multiple sources. For example, there's some kind of a trusted data center that the researchers work in, and all the data is copied there. And because it's a trusted server, we all believe it's trusted. But the problem is that this trusted server, once the consent is broad enough, can rather trivially copy the data to parties without the subject or even the original source being able to see that. And this can go on and on. So essentially the copying is a problem that was also emphasized in the last talk. Sorry. So there are also other approaches where copying is trying to be minimized, and one of the recent development is to have an emphasis on registration at the source to avoid copying, to make sure that you always fetch data from the original source and that you maintain changes there. And the main focus to that is to have to make sure that the data you access is accurate and current. What is not necessarily addressed with registration at the source, or with this idea or this movement basically, is that it still allows for copying because there is not a real legal or technical constraints on the copying. So you can, so there are still actually the same problem that I just had described. What we're trying to do is to change registration at the source, so it's just not about registration or accurate data, to authorization at the source. And that's what we try to do with Whitebox systems. And the Whitebox is actually an authorization platform that's being placed at the source, and you currently apply that with general practitioners. So the blue boxes are basically authorization and authentication platforms. And the idea is that a consumer or coordinating party does not really get a copy, but only gets a reference to the data that's being held at the source. And why is that important? Well, as I said, you try to avoid copying. So because copies basically go out of sight, it's easily possible that you no longer know where the data is. So what we try to do is to track downstream authorizations to avoid copying and instead have access by reference. And we make sure that's possible by ensuring that one given reference to data is unique and can only be used by one party. And for example, in research, it's possible that we define a coordinating party or a trusted third party who is responsible for making sure that researchers can access data once they fit certain constraints. So the coordinating party is actually a reference to a data source. But that reference does not necessarily give the coordinating party access to the data. It gives the possibility for the coordinating party to give access to researchers who will get access to the data. So if there is a consumer or research party that's interested in some data, and the coordinating party decides and can confirm that request is legitimate, the coordinating party can request a copy of the original reference and give that copy to the party who needs access. And then the consumer can access the data by reference and fetch it under certain constraints. Now what happened is that the original network of access, starting from the data source of the GP, was extended with a link that allows a new consumer to access the data. And the important bit is that this new link was constructed and issued by the original source, so the original source can keep track of where the data goes and who accesses what particular data at what time, because actually once the consumer needs the data, he will actually fetch it over the original reference. And by that, the source can see that the consumer actually retrieved some data. Well, this can be coordinated for a multitude of references. So the coordinating party can be actually a powerful party in the middle. But the important thing is it does not have the responsibility or the incentive to actually collect the data. It only has the role of disseminating access, so making sure that people can access data. And the end result is that, for example, this research party with a legitimate request will be able to get access to data, possibly temporary, possibly only for a specific purpose. That is all arranged by the original trusted third party who is in control over what kind of references are being requested, and the reference and the constraints that are attached to it. For example, the expiry, so how long the data is accessible, is all managed at the source. Similarly, you can do this downstream. So if there is a consent where it is possible and allowed to copy the data for a specific purpose with other researches, that can be done, but only by, again, copying the reference and such that the source knows about it. So it's transparent. And that's the important property of this scheme, is that all the data transfers and all the copying is transparent, such that if it's not legitimate, the original subject, data subject, or in this case, the GP at the source, can see this and knows where the data is and who accessed it for what purpose.
Guido, may I ask you to start wrapping up, because we are running over time a little bit. Thank you.
Okay. Yeah, I'm sorry, I'm already running out of time. Okay, I will wrap up. So the basic idea is that using a decentralized scheme where access control is actually decentralized, so you do not only store data and keep accurate data at the source, but you also always manage the access control by passing out references and ensuring that people will only get references, copies to references instead of copies to data. You can enforce policies at the source. There's also a way that you can separate concerns and responsibilities in the scheme. And it's, of course, imperative that a data subject can view all his access. So there's a way to hook up, for example, a personal environment to these decentralized access control to view the access log and possibly manage authorizations if you're the data subject and you can identify as such. So I will skip over the scheme, how this is being used in healthcare, but here you can see that there are different ways to extend the clinical network around a patient dynamically using the same principle. So the whole idea is that with decentralized access, you can maintain privacy by design by tracking all data transition in a data processing pipeline. So it's transparent. It's not just one hop you share with some party and then it becomes invisible. You really see all the data transitions. And it also actually provides a solution, but it's sort of out of scope for this talk, but it provides an actual solution for being able to have long-term provenance data available, where, for example, over 2 generations, you can also still see where the data went in the past, such that, for example, you can see where your DNA data was processed, because it was actually being shared by some of your predecessors. So your genetic relatives. Of course, there's some challenges, and these are similar to what are challenges in the pod world, for example, and the solid world, which are really not solved and are not that easy. How do you manage identity management? How do you authenticate and identify particular researchers and particular parties who can authorize or are authorized to access data and maintain that over time? So these are really difficult problems that are still not matched. So this is some information about me. If you want to reach me, we're in the process of starting a foundation for managing the standardization scheme such that it's open and can be used by multiple parties. There you go. Thank you.
Great. Thank you very much, Guido. There were some questions already. Please keep them coming in the chat. And at the end of the presentations, we'll pick them up. And of course, we'll make the presentations available as well afterwards. And Guido, I'm sure you will be happy to pick up the conversation if people have specific questions.
Absolutely.
Great. Thanks a lot. Moving on. Our next speaker is Sofie Hansen. Sofie received her PhD in epidemiology at the University of Basel. And currently, she is program manager for data infrastructure at Lygature, which is a not-for-profit that drives the development of new medical solutions for patients by managing public-private partnerships. Sofie works on one of their products, a research protocol Podium. And Sofie, you will tell us all about that, I think, in your presentation. So please take it away. Thank you. Sofie, I am not able to hear you. I'm looking at the other panelists.
Am I?
Yeah, there you are.
Oh,
wonderful.
Perfect. Thank you very much. Sorry about that.
No worries. And please make your screen. Yeah, wonderful. Thank you very much. Take it away.
So thank you very much for inviting me today, and thanks also for the introduction. So I think my talk here is maybe a little bit different than the others, but I still think it's an important part of the whole story. So maybe an important part of this pie, if you see it like that. I'm working as a program manager at Lygature, and one of the projects I'm working on is BBMRI. And the BBMRI project developed the tool Podium, which I'd like to tell you a bit more about today. So BBMRI really came more from the biobanking world, but with time has also moved more towards data banking as well. And really the mission of BBMRI is to make biosamples, images, and data findable, accessible, and usable for health research. And with that mission, we developed two tools from the BBMRI project. One of them is Catalog and the other one is Podium. And you could say that these two tools are the F and the A of FAIR, or at least they enable the F and the A of FAIR. So in order to actually request any data or samples or images, the researcher needs to be able to find them. So this can actually be done in Catalog, but the researcher also needs to be able to request the data or the images. So it also needs to be accessible. And for this, we developed the tool Podium, which I'd like to tell you a bit more about today. So just a really brief description of these two tools. So they're both web-based tools. Catalog actually provides an overview of most Dutch bio and data banks in the Netherlands. And researchers can find collections that share certain characteristics, and they can also assess the data in an aggregated form. Catalog is then coupled to Podium. So if you find data or samples that you're actually interested in that could help your research, then you can make the request in Podium, which is also a web-based tool. And the really big benefit to Podium is it allows for a single entry point. So both the researcher and organization has one single entry point where these requests for data, materials, or images takes place. It allows for a track and trace of the request. It's easy, it's fast, it's safe, and it also helps linked requests. So you also have the option of selecting this as a linked request, and then both organizations will actually be informed that the researcher is trying to make a linked request. So the ideal situation is really that the researcher first selects what they're interested in Catalog. It doesn't have to be the BBMRI-NL catalog, it could also be another catalog, and that they then make the request via Podium. And I think I mentioned some of these things already, but I think the big benefits are for the researcher that what to expect is clear, and also that the conditions and terms of use are clear, and also to really minimize time delays. So often what we see is that these requests are happening via email, and then the researcher doesn't know, has my request been received? Is it being processed? Is it under review? And for the bio or the data bank, it also enables the responsible use of resources, but also provides a uniform procedure and forms. And really it's a tool so that you can manage your requests. So I just want to give a short demo. So this is just an example from our BBMRI catalog where the researcher could actually search for something. So in this example, they search for abdominal aortic aneurysm and find two collections that meet these search criteria. The researcher can then say, okay, I would like to make a request. Then you get a pop-up window asking, are you sure you'd like to make a request? If you say yes, then you're actually brought to Podium. So this is a screenshot from the interface of Podium. Important to mention here, you do have to make an account in Podium, so you need to make a login and a password. But the nice thing is that the text is then already taken from the catalog, so you don't need to enter again what you already searched in the catalog, but you do have to put in some more information. So what is your research proposal? What is it that you're planning to do with this data? What methods are you going to use? Who's the principal investigator? And we really try to keep this as generic as possible. So I can imagine some organizations might want a lot more detailed information than what's here. But to keep it applicable as broad as possible, we kept it generic, but there is the option to also upload additional documents in Podium if that's required. So then the researcher can say, yes, I want to submit this to the organization. If they say submit, it's actually sent to the organization. This is just a screenshot from the dashboard of Podium from an organization view. So what's really nice here is that as an organization, you have an overview of all the ongoing requests. And in the left, you can also see in which phase these requests are. So are they currently being validated? Are they under review? Have they already been approved? Or are they out for delivery? And in this screenshot, this is just an example. So you see multiple organizations here, but of course you will only see requests that are for your own organization. Then here is just a screenshot from the validation phase. So at any point you can, as the coordinator, always go in and see more detailed information about the status of the request, but also what was the request, what was the research question. And this is also the stage that the coordinator could ask for any kind of additional information. So for example, if a terms of use agreement needs to be signed, this can also be arranged at this stage with the researcher. If this is all approved, then the organization can actually send out the request for review. The reviewers will then also need to have an account in Podium, but what's nice is they get an automated email that they have a new request which needs to be reviewed. They log into Podium. They also have the same view, so they can see everything that was submitted by the researcher, and they can then give their advice on whether this request should be approved or rejected, and they can also provide some additional comments. It's then always up to the coordinator has the final say. So based on the comments that the reviewers provide, the coordinator can decide, okay, this request can be approved, or no, sorry, this request is rejected. And they can also provide a reason for this. And if everything looks fine and the coordinator would like to send to approve this request, then you can, well, in the case of materials, you could actually release the materials or samples, and you can even attach a track and trace code so that the researcher knows where the samples actually are in the post. But if it's about data, then you could also specify here, for example, that the data will be provided through a remote desktop connection. And then we also ask the researcher to actually fill in once they've received the data or samples. So making this whole process actually a complete circle. So you really know at all times where the materials or the data are. So I just wanted to give kind of an idea of where we're at and maybe some of our struggles. So Podium actually came into production in 2019. Before that, we had visited a lot of different organizations in the Netherlands to ask them whether such a tool would be useful for them. We collected feedback from them. We also collected feedback on what kind of information they would require for the request. And this is also what our generic form is based on. Then once Podium was in production, we went back to these organizations to show them Podium, collect their feedback. So we also collected some wishes that they had for changes. And what we really struggled with last year is registering organizations. So of course, Podium only works if organizations are registered in Podium, because if they're not registered in Podium, then users can't make a request. But then let's say COVID maybe also brought with it some positive things, one of which is that I think people really realized how important it is to access data quickly and safely. And Capacity is actually started to actively use Podium. So I think they have now 32 requests for their data running through Podium. And we're now also in the process of updating Podium based on the wishes that we've collected so far from the different organizations. So we also hope to really improve Podium in the future. And I've also just put here a slide. So in case you're interested in knowing more or you'd like to use Podium, then I hope this slide can help you. So thank you very much.
Excellent. Thank you very much, Sofie. It's a great overview. Thanks a lot. All right. And again, as always, for people in the audience, please put questions in the chat. We'll pick them up afterwards. We're now going to switch gears a little bit. If you remember from the introduction, at least for me, one of the themes in today's webinar and the presentations is around control versus changing the data. I think we now had a few presentations that speak to different ways of essentially control, making sure that data access and the restrictions to data access lie with the owners of the data. So really putting the data owners firmly in control through, for example, distributed systems, or by having support for data request and data access workflows. We're now changing gears a little bit and moving to another potential solution route, another way of making research data with confidential information available for research, which is the what we called in the first slide modify, so the modified bucket. The first presentation along that line will be by Wim-Kees Janssen, who is the CFO of Syntho. Syntho is a company that he founded together with two friends, so that's always a great way to start a company. Syntho is a startup. It's the winner of this year's Philips Innovation Award. In a sense, it's new and it's fake, but it's definitely not fake news, and it really tries to solve the use of privacy-sensitive data by creating synthetic data as an alternative to using actual data using artificial intelligence. So we're curious to hear how that works. Wim-Kees, the floor is yours.
Yes, thank you, and always great to start with such an amazing introduction. Yeah, as said, my name is Wim-Kees, and I will guide you today to the world of data and privacy. And key takeaway for my session, classic anonymization techniques do not result in anonymous data. And in this session, I will demonstrate how synthetic data is different. And let me start with big data, because this was the promise of last decade for innovation. However, now in 2020, we see only a part of this promise being realized. And the key question is, why do we not have this fully delivered? And one key reason is privacy. And privacy is not only the heart of our free society, it also impacts companies, right? Because it can damage their reputation. Clients can leave and causes penalties. So privacy hinders data-driven innovation. And we need a solution for this dilemma. Ideally, your innovation manager and your compliance officer will become best friends. Now, those classic anonymization techniques that I mentioned, they offer no solution since they cannot fully mitigate the privacy risks and destroy your data. But why is this the case, and what do we exactly mean with classic anonymization techniques? To start, with classic anonymization techniques, we imply all methodologies where one manipulates or distorts an original dataset to hinder tracing back individuals. And examples of those classic anonymization techniques that you might recognize are pseudonymization, wiping, data deletion, generalization, and row and column shuffling. But why does this not work in practice? Let me illustrate this with a sample dataset that contains customer data. As you can see here in this example, this is a simple, typical dataset containing client data. In the first row, we see Olivia. She's 26 years old and bought shoes on 4 March for a price of 125 euros. So typically one starts with removing various attributes from the dataset. And as you can see here, the names are simply removed from the dataset or replaced by a pseudonym. While some already stop here with applying classic anonymization techniques, others continue. So in this example, we see generalization. So Olivia, being 26 years old, is now placed in a bucket ranging from 25 till 30 years old. And of course, one could continue applying those techniques on the data, and note that one thereby also continues to destroy the data. And this is really what happens with applying those classic anonymization techniques. The value of the data is destroyed, and this is a big disadvantage if you would like to use this data to realize data-driven innovation. But there is still another disadvantage. The second disadvantage is that one will always have a privacy risk. And this is due to the fact that there will always be a one-to-one relationship between the original data and the anonymized data. As you can see in this example, Olivia, being 26 years old, is still in an anonymized dataset. It is only slightly harder to trace her back, but the risk of a linkage attack will always be there. And the main question is, how big is the risk of a linkage attack? And let me provide you with an example. the researcher named Sweeney demonstrated this in an academic paper. She showed how she was able to identify retrieve sensitive medical data from individuals based on linking a public available data set of hospital visits to a public available voting register. Both datasets were assumed to be properly anonymized through the deletion of names and other direct identifiers. So basically all direct identifiers were removed from the dataset, as you can see in this example. However, based on only the 3 parameters, zip code, gender, and date of birth, she showed that 87% of the entire US population could be re-identified by matching aforementioned attributes from the dataset. Then Sweeney repeated her work with having place as an alternative to zip code. Additionally, she demonstrated that 53% of the entire population could be identified. And finally, Sweeney repeated her work with having country as an alternative to zip code. And here she demonstrated that 18% of the entire US population could be identified. And why is this so important? It demonstrates that it can be remarkably easy to identify individuals in a seemingly anonymous dataset. Only having access to 2 or 3 attributes might already be enough to trace back an individual. So anonymization and those classic anonymization techniques do not result in anonymous data. And to get to our solution, I would like to ask you to take a look at those 3 images. Which of these 3 images do you think is fake? They're all fake. The faces you see here do not exist in the real world. These are synthetic images generated by artificial intelligence. And although AI and privacy are often put as opposites, we believe that technology can be used for good. And this is one of the core beliefs within Syntho. AI and privacy should be allies instead of rivals. What if AI could offer a solution where you do not need to use original sensitive data anymore? What if one is not only need to choose between data and privacy anymore? And what if this generative AI that we saw in this example could be applied on structured data sets? And this is exactly what we do at Syntho. Our Syntho engine is trained on the original data and generates a completely new and anonymous synthetic data set. And what makes us unique? We apply AI to capture the value of the original data. The bottom line is, our synthetic data is highly realistic and can be used as if it is real data, but without the privacy risks. And key question here, how is this different compared to those classic anonymization techniques that we saw in my previous examples? First, there are no one-to-one relationships anymore between the original data and the synthetic data. Olivia from 26 years that bought shoes simply does not exist anymore in a synthetic data set, nor her corresponding attributes. Second, on dataset level, we are able to generate synthetic data in such a way that we preserve the patterns, relationships, statistics, and so and so. So in other words, we generate synthetic data that can be used as if it is real data, with the preserved data quality. And the key question, of course, is how good is the data quality here? We offer a quality report for every generated synthetic data set to demonstrate this. And here I would like to take you with me in this quality report. So let's start with simple distributions. They give insights in the frequency of a certain data record for a given category or value. And as you can see in this example, the distribution for the original data in gray and synthetic data in blue are nearly identical. Correlations provide insight in the degree to which 2 variables are related to each other. And also here we see that the correlation matrix for the original data and the correlation matrix for the synthetic data are nearly identical. And we can also take this one step further, where univariate distributions and correlations provide insights in the distribution and relation for a single category. Multivariate distributions provide insight for combinations of categories and are also captured by the Syntho engine. Again, here in these examples, we see similar results. And the ultimate test is to train a machine learning model for both on the original data and the synthetic data and compare the outcomes of those models. And even in this ultimate test, we observe a similar result. This shows that synthetic data retains statistical properties to such an extent that even machine learning tasks is an alternative for using for sensitive data. And next to the superior data quality and privacy protection, there's another key feature. As a result of not having one-to-one relationships, one is able to generate an unlimited amount of data. In this example, suppose the original dataset contained 100,000 records, one can simply decide to generate a synthetic dataset containing 800,000 data records. And therefore, we always ask this question: why use real data when you can use synthetic data? And this is our answer. First, you can minimize personal data and thereby reduce, for example, data breaches. And second, you can unlock personal data that was restricted due to, for example, privacy. And in summary, synthetic data by Syntho allows you to build a strong foundation to boost data-driven innovation with less risk, more data, and faster data access. And this unlocks a wide variety of use cases that could boost the realization of data-driven innovation. But let me illustrate data sharing. Highly sensitive customer data is typically collected in any corporate and cannot simply be shared internally or with third parties. Consequently, those corporates cannot realize data-driven innovation, for example, with AI. Our solution shares this data in synthetic form to guarantee both the data quality and the privacy protection. And benefits for those corporates: less risk, more data, and faster data access. After our visit, those corporates can test, develop, and innovate with synthetic data. And I see you all thinking, can we already use this? Yes, if you are interested in our solution, please contact me at info@syntho.ai or visit our website or do the synthetic data scan at syntho.ai/scan. And via this scan, we help you to explore the potential value of synthetic data for your organization. So why use real data when you can use synthetic data? We are Syntho and we solve your privacy dilemma.
Great, thanks a lot, Wim-Kees. Absolutely fascinating stuff. I do hope we were listening to the real Wim-Kees and this is not a demonstrator of your AI capabilities.
Yes, it's me.
Great, thanks a lot. Fascinating stuff. All right, let's move on to the last speaker in our series of rapid fire presentations. That's my colleague Robert Griffioen. Robert is a project manager at SURF. Before joining us at SURF, he worked at the CBS, or Statistics Netherlands. And Robert has been leading the development of pseudonymization services for a number of universities, including universities of Groningen, the Medical Center in Groningen, Leiden, and Free University. And he's been doing that as a project manager at SURF. So Robert, the floor is yours.
Am I unmuted now?
Yeah, we can hear you now.
Okay, we can hear you, but
we can hear you and we can see you. So all fine.
We can see. I can also see. Okay, thank you.
Thank you.
So yeah, it's hard for me now to present after the other talk. I'm developing a pseudonymization service for the universities, but I have other challenges than the other talk that we just saw. Let's continue. The project started 3 years ago, and it was initiated by the IT directors of the universities. And their problem was that the GDPR would take effect in 2018, and the universities wanted to do something with privacy to show that they take it seriously. So that was 3 years ago, and there was we had a whole bunch of propositions that we could develop for them. You see here seven different things. One of them was pseudonymization, but another one was to have a help desk for researchers. It's a completely other thing. And the focus at that time was on data linkage, because also medical centers were involved in the project, and they had a previous project where they found data linkage very important. But yeah, universities, they were not as far as the medical centers, so they decided, data linkage is fine. And it was about data linkage between data sets of different institutes. And what universities, they say, we already have problems with simple privacy, simple privacy things. So let's begin simple and start with pseudonymization. And a second decision that we took in 2018 is that we were not going to develop it ourselves, but buy it in the market. So what we did is to have a tender, and I think the tender is not that important. I think it's important what the content of the tender was. We distinguished 4 types of use cases. And the scope of pseudonymization, of anonymization, etc., was to do it with structured data sets. So you can also have text, but we decided to do it as simple as possible and start with structured data sets. I had a slide to explain pseudonymization, but the previous speaker already explained it, what the different types of pseudonymization, at least partly. So here you on the most left side you see the source data, and when it's pseudonymized, you pseudonymize the name, in this case the house number, and the BSN, your burger service number, and you give to the name and the pseudonym you give pseudonyms, and they are where my pointer is. And you can also have another type of pseudonymization, and he already also explained that is more like aggregation or generalization. Instead of giving the exact birth date with the day and the month, you only give, for example, the year. But to explain a bit further, there is not only, we distinguish these 4 use cases, and we have irreversible pseudonymization and reversible pseudonymization. Irreversible pseudonymization is if you make pseudonyms and you do not generate keys with it, so you cannot get back to the original data set, to the original names. And with reversible pseudonymization, you generate keys with it, so you can go back. And why do you want this? If you are doing research and, for instance, to language, and you find a tumor during your language research with a test subject, you want to report that possibly back to the subject. So then it's necessary to have reversible pseudonymization. And let's also, because the other speaker explained it already, what pseudonymization is, and I have some time to reflect on what he's stating, because I have use case for it, anonymization. And anonymization is that I define it, or it's not, it's in the field defines it, that you want to diminish the possibility of re-identification as much as possible. But it's not saying that it's not possible. It's just you want to decrease the probability as much as possible. And these use cases are also, they are within a university, and it is exchange from research between researchers during the research. So it's not between researchers. That's what you want to prohibit. So that's we don't want to set this to exchange this data, or want to set this data public. So I think with all things we've seen, they're all different use cases. So to just get ahead of the discussion that we can get. So that's what we had in 2019, and you have seen the different types of pseudonymization we distinguish. I call it de-identification, and de-identification covers pseudonymization and anonymization. So what the business case of this simple pseudonymization is that at this moment at universities there are all kinds of research use all kinds of different tools and the management is not aware of what they are using and what the quality of the tools are. So what we want to achieve with this pilot, with this project, is that researchers use as much as possible the same tooling. And in the first place, it's this tooling that I present, but it could be in the future, there could be other tools, like, for example, the Syntho tool. But this is just a start. And besides the tooling, what also is very important is not to only to have tools, but to have an organizational process around it, to have a workflow. So here's an example workflow. I made this before the project even started, so it's not a workflow that is that is maybe is there, but it's an example. And for instance, you see here, you want sometimes to store data at a safe place. That is what is in this workflow. And if you don't keep to this workflow and you don't store it at a safe place, you can have as much good tooling as if you want. But if other researchers or other people can get to this, to your original data, it doesn't matter what how you put your anonymization, pseudonymization, or your synthetic data set is. So besides the tooling, we are designing a workflow around it to keep the whole process as safe as possible. So where are we now? So there's this company, SurfDTP, which is developing the use cases for us, and we are now implementing use case the irreversible pseudonymization use case and irreversible pseudonymization use case. I think it's not interesting now to go into details how it exactly is implemented or how they want to implement it, but we are at the stage of doing this, and we furthermore designed a first version of a workflow. So in the future, what we want is that we want to make this this pilot a production service. So now only a few Hylke presented or mentioned a few of the members of SURF that are participating, but there are only 4 or 5. And if it's a production, if you think it's good for production, we offer it to the other SURF members, and we offer with it the organization process that we have made around this tool. So I think this is it. If you if you are from an institute and are interested in it, probably next year we are finished, so you can contact me then. Okay.
Great, thank you very much, Robert. And let me first of all thank all of the speakers once more. I certainly enjoyed all of the presentations and I've learned a lot, and I'm sure that holds for many people in the audience. So again, thank you all really very much for your time. We are running a little bit late in terms of the agenda. We still have 15 minutes for the webinar, and I do really want to close at 3:30 to be respectful of everybody's time. It was a bit ambitious, of course, to have 5 presentations with exactly 10 minutes each. And also there are many questions coming in. So I think that is a great signal that usually shows that people have learned something and are eager to learn even more. So what I wanted to do is take at least one question for all of the speakers, and I will make a selection, and then I can ask the speaker to respond to that. So we take about 10 minutes for Q&A, and then just close by again taking the temperature in the room if you would lean towards the side of control or the side of modification, just to close the loop on the question that we asked in the beginning. There are more questions than we can address in about 10 minutes. So what I wanted to do is ask the speakers offline to give their responses maybe in writing, and then we'll make that available on the website if that's okay with everybody. So that way we make sure that all questions are addressed. All right, so let's do that. So I'll make a selection of some of the questions and then ask the speakers to respond to that. And I'd like to start at the beginning. So a question that came during the presentation from Dexes, from Hayo and Joep. There was a question from Elise Vlijnic about the audits. At some point in one of the slides you mentioned audits. And the question is, who would actually be performing those audits? Hayo or Joep, could one of you address that point?
I think I will answer them. This is Hayo. Actually, the audits are probably mostly depending on the conditions that the data owner sets. The data owner can say, I just want a log of who accesses the data at what moment, but there could be more conditions for audits. So what we see is that the most important thing is we don't access the data that's going to flow from data owner to data user. So we have to see what we can audit without touching the data. So we can audit a bit, and when the data needs to be touched to audit, we probably need to rely on a service that can do this.
Great, thank you very much.
I hope Elise is happy with that.
I think that addresses the question. If not, Elise, feel free to add in your chat and then we'll pick it up afterwards. Thanks a lot. I think that's clarified. The next question is also from Elise. I just noticed right now because she's asking a lot of good questions. And this is for the second speaker, so for Guido. Elise mentions that earlier this year during a Health RI event, the public health train was promoted. And the question is, in what ways does the Whitebox work in a similar way, or do you guys collaborate with the personal health train?
Thank you. Yes, we do collaborate a bit. In particular, that DNA genetic logger is a project that comes out of the personal health train context. However, it's quite imperative that the personal health train, it is similar in the sense that a PhD also emphasizes decentralized data storage, where you have trains that visits the data stations, but and that is similar. However, we do not index the data, so there's a difference that we also share the pointers and the metadata through active authorizations. So it's not necessary that we have a catalog of data, which is the case in the personal health train, because it's really decentralized, so we avoid all centralization if we can. And the only centralization is there when some data source actively chooses to authorize another party.
Great, thank you very much, Guido. Moving on to the next question, which is for Sofie about the podium presentation. This is a question from Linda Rieswijk. The question is, in the worst case scenario, how do you avoid that copies are being used by other researchers? Is there somehow a way to register that copies are being made? Is there some kind of a tracker on the data?
So thanks very much for that question. I think it's also an important question. This isn't really an aspect which is part of Podium, but it's actually up to the organization providing the data that this is done in a good way. And if I could give a recommendation, then I think what works quite well is some of the organizations we spoke to, they only give researchers access to a remote desktop. So they basically get a login, and they have to log in, and there they can then access the data, they can analyze the data, but at no point do they download the data. And when they're finished, they can no longer log in anymore either. And the organization is able to track everything that's been done with the data. But this really happens outside of Podium, and it's for the organization to decide, but definitely an important aspect.
Great, thank you very much. And so you do provide tooling or solutions to at least help mitigate that concern? Yeah, great. Thank you very much. Moving on to the next question. This is for Wim-Kees about Syntho. A question that actually also sprung to my mind from Leonieke van den Bulk. The question is if your approach, the Syntho approach, also work for data with a big amount of variables, and in particular, is the AI still able to capture all of the correlations in data with many variables?
Yes, the answer is simple, and we typically have something like a sum of rules to say, like, for one column you need an additional amount of data for 1,000 rows. That's a little bit the rule of thumb.
Yeah, great, thank you. I don't see any questions for Robert unless I am overlooking them. If I am overlooking them, then maybe one of my colleagues can alert me. I think we have a bit of time to do one more round of questions. So let's go all the way back to the beginning, if that's okay with everybody. So another question for the people from Dexes. A question from Janssen. Who will host the personal data vaults, and how do you search in a personal data vaults without going through personal sensitive data?
I think Joep can answer.
That's true. Well, since all the pods are open source, anybody is free to host them. To get things started in the early beginning, we will be also hosting them as well. And regarding search, they will have built-in search functionality. So you don't have any sort of external service that will search. You can search inside your own pod using the built-in tools.
Excellent. Thank you very much. We have also another question for Guido about Whitebox system. This is a question from my colleague Freek. So Guido, you emphasize keeping data at the source. However, most general practitioners or pharmacists are not computer security experts. So how would that work? How would they be able to do that?
Yes, well, we propose with Whitebox actually a standard, so an authorization standard that emphasizes access control at the source. So it's basically a capability model. The implementation of that can vary. We currently have an implementation where we actually provide a box, that's literally a white box, to physicians that implements this authorization logic. But every physician has a kind of an enterprise resource management system, an EPD provided by, that's just standard practice basically. And that can implement these protocols as well. Or we can provide source code or libraries which helps these providers to implement the standard. And when we say at the source, we actually have a physical box right now at the source, but of course it's really a legal term. So it's about who is responsible. And this responsible party typically is a GP or a physician, and that physician should keep control, but it can actually be, for example, using an ERP system in the cloud. So there's no really constraint as long as the owner, the responsible party, has control over data access. That's basically the idea.
Great, thank you very much. One more question for Sofie related to the podium presentation. The question from Elisa Vlijnic is, are there additional plans to add patient-reported outcomes, for example, so that all data from clinical research may be included?
Yeah, thanks very much for this question. I also read it in the chat, and I'm actually not quite sure I understand the question, but it could be because it's more than related to having that information in catalog. Because in Podium, we don't have any data. So really the researcher needs to know exactly what it is that they'd like to request. So they need to have been able to search some kind of catalog and make a selection of what it is they would like to request. And the only information that is in Podium is their research question and what they actually plan to do with this data. So it could be that Elise's question relates to the catalog aspect, I'm assuming.
Yeah. And if there's a more detailed question, or if you would like to elaborate on that, I'm sure. So if you leave your email, that holds for everybody. If you leave your email address at the end, we have a Menti in a few minutes to close the session. If you have specific questions or you would like to have some follow-up, please leave your email address and we'll make sure that we connect the dots there. While, of course, preserving your privacy. Last question for Wim-Kees about Syntho. A question from Michiel Schok, my colleague. The question is, when training AI, do you need to know what algorithm is going to be used in the data analysis?
No, but yeah, what we typically do if for AI models, things get a little bit complicated, like you want to have better matrices to test the outcome. We typically talk together to define a specific metrics to test the performance on synthetic data compared to the performance on the original data, to make sure that we can also test the quality in this specific AI model. But that's more the other way around. So the answer is yes, and we also always think along the way to also make sure that we can test it with you.
Yeah, great. Thank you very much. All right, we have about 5 minutes left. I propose that we close the Q&A session, and again, we will make sure that the questions that we didn't have time to cover now will be answered and make them available online. 2 more questions to wrap up the session. As you will remember, in the beginning, in my introduction, we spoke a little bit about 2 different routes or 2 different approaches to dealing with sensitive data and sharing. One is around control, access control, making sure that nobody may touch the data unless that is accepted by the data owner. The other is around modification, basically changing the data such that it may be used by anybody. Two different approaches. I wanted to ask the same question again. Which of the two would you see most potential, having heard what you have heard in the presentations today? And of course, I'm really interested to see if there are changes and if the presentations have maybe give you different perspectives. Going to wait a little bit. We have 27 votes, or 28 people so far responded. We still have over 90 participants, so I expect some more people may cast their vote. Interesting. If you remember in the beginning, before we had the presentations, at the beginning of the webinar, the split was around 50-50. And it seems that more people are leaning towards the control side after the presentations from today. It's an interesting observation. Gonna leave that open just a little bit. Of course, interesting question, especially for those people who have changed their mind or have changed their perspective about, well, what type of approach they would see the most potential. Would be interesting to hear a little bit more about that. Freek, can you go to the next slide? So just curious for those that have changed your mind, and that could, of course, just be because you now understand it better or because you have not realized something that you have realized now. But there might well be some material changes, perhaps an aha moment of something that you just learned during those presentations. If that is the case, we'd love to hear. So far, only people who did not change their minds. Better solutions, all right. Nice methods for control, all right. On the other hand, somebody was also impressed with the synthetic alternatives, new insights, some pitfalls that were pointed out around modifying data. That's a good observation. Would be marvelous if the data subject itself is in control. Control seems really possible. It's an interesting remark. I see some fans for synthetic data with 2 exclamation marks. I think Wim-Kees, you will like seeing that. Somebody emphasizing the how data ownership is key. I think we all agree with that. Somebody's remarking that at the end, control may not be possible. Somebody's even more convinced with control. Super interesting. We'll make these available as well afterwards so that people can take a look and maybe be inspired. Great. Thank you very much for sharing. Hey, that brings us to the end. It is 3:30. Freek, can I ask you to go to the very last question in the Mentimeter? So yeah, if you would like to get in touch with one of the presenters, if you have follow-up questions or you would like to know more about any of the technologies or the solutions that were presented today, please leave your email address and also indicate which solutions you are interested in. We're including also the technologies and the solutions that were presented in the first webinar in June. So if you would like to some follow-up about that one, you can also indicate that in the Menti, and we'll make sure that we bring you in touch with the right speakers. With that, I would like to close the session. It's 3:30. We already took 90 minutes of your time. Thank you all very much for joining. Thank you once again to the speakers. Again, I really enjoyed it and I learned a lot. And I hope that counts for the audience as well. So thank you all very much and hope to see you all soon.